Welcome to the Best Business Practices in Healthcare, the podcast where we talk about the business side of healthcare. We've got with us Jamie Adema today. Jamie, I'll let you kick it off with a quick introduction.
Well, good morning, everyone. It's a great opportunity to be a part of this. So my name is Jamie Adema. I have been in healthcare for almost 20 years now in many different kinds of sectors and areas. Starting off my career in imaging and then continuing to start to progress into operational events both in the systems as well as independent practice and as well as key groups. So I've had the blessing to kind of be very diversified both from cardiology, radiology, kidney care, and as well as dermatology and many other kind of subsections inside of service lines. So I'm happy to join today and look forward to talking about the topics that we have in mind.
Perfect. So Jamie, I always ask our guests to really kind of bring what is a problem that we often find that we have to solve in healthcare, especially that business side of healthcare to keep the wheels turning. And I know you brought a topic today that it really affects everybody, right? I don't think this is one of those things that doesn't affect a practice. So what was the issue and what is it that we're trying to solve today?
Some of the things that I think really, in operations especially, we really deal with supply chain and continued utilization of consumables, in what we produce for patients. And I think, as we continue to evolve, whether it's a health system, independent practice, or PE group or medical group, whatever it might be, this really is a cause and effect. It's, as you start to look at what both from prices and what you use and how you utilize it, when you have multiple different departments or multiple different practices in a system, you come to find that there's a lot of variability in what is being used. And I think that's one of the biggest challenges. You want to create efficiencies, you really want to dig into how do we make this more cost effective, but we're still giving physicians the abilities to practice the way they did, the way they've actually been taught how to use certain pieces of equipment. And I think that's a key, struggle that we have. But I think it's actually a really doable and solvable type of thing for us. So, in the past years, as being part of PE groups most recently,
and Jamie, just for those who don't know the acronym PE.
Yep. So for those who are involved with private equity groups, it's an investment organization that essentially invests in practices, and those practices then become part of the plan. Now, what we try to have is we allow autonomy in the structure, but it's critical that we start to really dig into creating group purchasing power and also starting to begin to create tiers of volume by actually driving costs. So as we start to go into this, it's really critical that we start to provide solutions or options for them, pick between products and supplies that best suit them. And by us starting to develop this and put it into practice, we can give them options. And then therefore, from those options, we start to drive our tier pricing and our abilities to drive volume. And then that drives the abilities to drive down overall cost of the system. Now, in recent times, from the perspective of that, there is challenges that go along with this as you progress. It's not a simple process. It's definitely a time-consuming and strong investment by the organization to provide solutions that make sense, and ultimately then being able to negotiate with your vendors and to be able to provide that level of service both to your vendor and, of course, in the recent months and time, we've started to really divulge into this. And in my current groups, we've really focused on really developing solutions and tools that work well, essentially coming up with options for procurement systems, which, again, many of our vendors now are providing procurement systems to track and take stock and inventory of products more effectively and efficiently, really streamlining abilities to know what's par. So really the number of items on the shelf, I will have those items, and essentially then how we use those items in the current work environment. Well, do we use them at certain cost per position? And so we have a practice currently in Arizona. that we piloted with, that we've brought them onto this concept. And we've integrated both the procurement system along with their EHR. And we've come to find that when we can create great integration between the two, we find that, again, the overall outcome is much better. Implementation with the different systems is one of the critical things that you want to try to solve for as soon as you possibly can. Now, the benefits now have come to be resolved. We're approximately about 180 days into the pilot, and we're beginning to see the fruits of our labor. We're seeing, again, certain products of why they're using them. Some of the products are, certainly higher cost versus products that are low. As we've now started to be able to consume the information, we're starting to break down the data. And the data is starting to give us a general ability to create a formula. And that formulary is the critical thing that we'll start to actually break down, work with our vendors to come to a contracted price, and therefore we'll put those certain products into our system, and then we will probably move forward with those types of mentalities. So it's a very fruitful thing. It's an excellent, utilization. It does take a period of time. It's not something that's a short-term, quick turnaround, but your investment is worth the time. It's worth the overall, 6 to 12 months as you go to see it as a long-term efficiency. It creates habits and creates really effective type of utilizations.
So it sounds like a lot of the upfront work is that data collection. Like you said, figuring out what is being used and why is it being used and the frequency, right? So that's a lot of data that's being collected up front that then is allowing you, and correct me if I'm wrong, then is allowing you to take that data and get the best price for those supplies.
Yeah, absolutely. And I think that's a great way to look. It's all about data driven. Everyone from perspective of vendors to physicians, everyone is a very data driven. I mean, they're always the truths are in it. If you don't have analytics with a story, you don't have anything, and it's just versa. If you have a story without analytics, it's the same. So
Right.
it's really our job to really dig into that level of information where it creates a factual direction, for everyone that's in it. Because guesswork is not real. And vendors, I think, appreciate it because now you're really creating partnership. And then thus far, the vendors are willing to provide more assistance, both from communicating to physicians and as well as delivering at a higher level of satisfaction and quality because there's that partnership and investment. And I think that's a beautiful partnership as you start to go because, questioning what you're getting or what your overall outcomes are, I think makes it much more effective in the long run. And especially when there's things that change in the market, your vendor is not necessarily looking at price gouging you, but they're trying to, again, work with you to offset both their profits and as well as yours.
Right. So during that data collection phase, what are your biggest challenges during that timeline? Is it really just the integration of the two systems, or is it part of the team? What are your challenges there?
I think one of the challenges is whether it's true. I think that the data integrity is one of the hardest things because, many practices sometimes are behind in understanding how they even collected this information. Do they have historical information that prove why they do and what they do? So some of it's actually paper, some of it's not actually even computer-driven type of mentality, and they don't know what they don't know. So that's kind of sometimes your first step is to kind of begin to do that, and then you start to divulge into if they're data-driven, if they have technology, then you kind of have a leg. Otherwise, you have to start really digging in. Is invoice collection, looking back at utilization and taking estimates and assumptions sometimes skew your data and information. But in all reality, it's really that finding an investigation, discovery period. That you can kind of avoid the noise and to come up with what kind of makes sense from there. I think the second thing is technology is one of those things. How do you integrate? How can you make certain things more effective and efficient? Because these are things that everybody wants. Vendors want it, practices want it, really comes down to, how do we track this and how do we come up with methodology that makes sense to achieve, our ultimate goal. So those are the two things that I think really at the beginnings can create
Hmm.
both some discouragement, but you just got to stick with it and keep going and trudging through it, because the overall reward is much greater in the long run than it is for a short term gain.
Right. Well, and you're piloting this with one group now, and I assume as you get this program put in place and you start rolling it out to other practices, you now are faced with new challenges of maybe moving everybody to a standard, not only solution, but maybe even standard supplies. Is that accurate?
That's very accurate. Yes. It's, you try to figure out what size fits all. And,
Yeah.
one practice is one practice. I think one of our mentors always said is once you've seen one, you've seen, and you have to kind of understand and work through some of those key things as you kind of take it from scale when you scale. One of the things we've always talked about is if it doesn't scale well, you're essentially at a place that you're never going to actually move forward. And I think that's critical. You have to put that in your mindset as you kind of take this forward, because as you think about one, then you got to think about 5, and then 10,
Mhm.
and then if you have a network of physicians, you have, instead of only 2 physicians that have an opinion,
Mhm.
you may have 550 or 700 physicians that. So it's all about really critical communication and really starting to break down what the evidence-based information is, creating formulary, working kind of with the trends, and then begin to really create that communication model. It's always good to prep. It's very good to roll out in an effective manner, and physicians appreciate it. When you're doing it that
Mhm.
way, have an effective rollout, and physicians are more engaged and they're ready to participate in the overall versus again just rolling something to them and say, here it is, use this the way this is, and ultimately again they create frustration and then essentially loss of engagement, and then it's the desired. So I feel that's a critical step as you start to move forward.
Yeah, and it sounds like what you're trying to achieve is getting the buy-in, right, of the physicians and the new practices that are going to roll into this model. What are some of the best tools in your tool belt or suggestions that you have to get buy-in when you're making a change like this? Because, like you said, people sometimes get a little married to a certain supply or a certain supplier. How do you get that buy-in?
Yeah, that's a great question, because I think really what critical buy-in is finding really great. So when you
Mm.
initiate doing a pilot, you want to work with really great leaders, both from a
Mhm.
physician standpoint and as well as administrative and clinical and clerical. All those different components are really critical. You find a champion and you utilize your champions to continue to foster. We come to find that we've used our physicians sit on our operational and clinical board as kind of that catalyst to helping other physicians see the vision, see the overall outcome. And they've been fantastic. I think they do a great job of communicating with our physicians. They give the whys on why this is really critical and where we can go with it. And that essentially helps subside some of the skepticism and some of
Mm.
the frustration. Now, it certainly doesn't stop the questions. I mean, you still get the
Right.
questions, you still get the overall, what about this and what about that? And does this play a role in what I'm doing? Then we have to take those into account. But at least having someone that is kind of that mediator, it helps a lot when it comes to clinical. And, and I've always come to find if you don't have a great clinician,
Mhm.
that's going to be a problem, because I, as an
Mhm.
administrator and a non-clinician, cannot be the decision maker in these types of factors.
Yeah. Well, I would say throughout my career, I've known that anytime that I have built a champion group or had that strong champion leader, when you're trying to make a huge change, is probably one of the most effective things that I've seen happen, right? I've seen projects where we've not had a strong champion and the provider isn't engaged and it just doesn't go as smooth as when physician that's championing it is so engaged and so committed to the project that they're out there, they're talking, and they're discussing. I mean, and I reflect back, actually thinking of an EHR implementation that I did in New Mexico, and the physician champion was so engaged, so much so that he dressed as Dorothy from Wizard of Oz, and he even had size 13 red sparkle shoes and walked around with a basket and a dog. And it was just, that to me is like commitment, that you are committed to the success of a project, what it is that you're working on, right? So in the end, when you've done projects like this before, and you've been able to solve some of these supply chain issues, what's the ideal picture look like at the end?
For us, I think the ideal picture is first, really creating, I mean, quality in healthcare is really the first essential. I think when you're going into it with that mentality that you're both, serving your patient, then you're serving your provider, then lastly, you're overall serving the organization. Those are really the three things that kind of direct me when I'm trying to essentially kind of in this situation. I do think, quality has been, we have also, picked products that essentially are not the cheapest, and they're not overall the best, but they're the one that provides the greatest quality. And our physicians have had really good feedback about, like, this works better for this reason. This is the scenario I use this, and that's been really effective. And I think when you're going about it that way, and not always just thinking about the bottom line and only the best costs and only the best savings, you're gonna actually get a really great out. And then when you're thinking about it from a provider standpoint, providers have learned, they've invested their time in products for a long time, whether it's for residency or fellowship or whatever it might be. They've become very products that they know are going to create great quality. And that's very important. We don't want to put them in scenarios or situations where they are questioning whether or not they can provide the best health care to the patient. And I believe that strong is we want to take care of people first, and then figure out, ultimately what is the best business. Then lastly, as we said, organizations are critical. They function because we are good stewards of the financials. When we're a good steward of the financials, when we come up with good methods, good strategies that make sense of that, we essentially can provide the physicians and as well as the patients better options. We can provide them with more than what we could if we were essentially not a good steward. And I think that is, at the end of the day, very critical, because organizations are here to run. They're here to provide a solution to what patients need. And when we do that well, then essentially it's actually a trifecta situation where everyone has something to gain out of it, and there's abundance in everything that we do.
Jamie, I really appreciate those 2 points for quality, and that you're focused on quality, not just what's the least expensive, what's the cheapest you can get in the door, right? Because you made some great points on the quality there. And then the steward of the finances, I mean, the steward of the organization, that's always a tough line to walk, but it is a really important line, and is what keeps organizations viable, right? And keeps everybody happy. So anything else that we really haven't talked about regarding supply chains or this type of project that you think you ought to bring up?
I think the biggest thing is don't lose heart. Supply chain is a challenging type of project to take on, and don't ever lose. It's something that you can try, and sometimes it's innovation, it's creative, it's being willing to kind of step out of your comfort zone to take on something like this. And when you're willing to do it, there's a lot of obstacles. There's a lot of things that come along with it, but it's very fulfilling, and it will ultimately, again, make it into your organization, and then also, like I said, back to your providers and as well as your patients. And when you've done that and you have really put that level of energy and time into it, there is no greater fulfillment and success, both from personal level and as well as generally why many of us got into health was because we wanted to care and develop a system that is the best and the brightest in the world.
Yeah, a great advice and great way to end our discussion today. Jamie, thank you so much for joining me and being on the podcast. And I appreciate it. Thank you, everybody, that has joined us online.
Thank you, Jerry.